us this afternoon. Just a quick logistics thing. I think Jen has muted all the lines because some individuals don't have their lines muted, but this is an open conversation, so please unmute your line if you would like to say something. So first, I just want to say thank you for joining us, and I'm representing Marcus because Marcus is currently working out things with his kids as his kids are out of school right now. So he apologized that he could not be here today. So we have a couple messages to share with you, and so I'm just going to read them right now. So first, this call was really an exclusive demo for anyone who's really supported us over the last year, which is a lot of people. So if you're on this call today, it's because in one way or another, you've participated in contributing to the HQCA's development of panel reports in the past year, whether you sat in the resource design working group and created tools and resources, whether you sat on SOG and gave us ideas on what measures to include or not, or whether you were part of the digital design working group and gave us a sense of how the platform should look and feel. So thank you. Second of all, we just got an update from Andrew, who's our CEO, and he's asked us that for the time being that we do not release the reports. So the date is pending now. So the initial plan was that the reports were supposed to go out to family physicians tomorrow. But given everything that's going on, he's just asked us to hold for now, and the date is pending. As soon as we hear more guidance, we will share that back with you guys. Thirdly, I want to say that when we do end up launching the reports, we're happy to be here and support the team and anyone who's supporting physicians. So we can have another call like this, because I know many people probably can't come right now. We can do whatever we need to ensure that you guys have what you need to support your physicians in the field. And lastly, I just want to say that today's call is being recorded. I realize that we had a couple family physicians who said they wanted to come, and now I suspect they're quite backed up with other things. So those are kind of the announcements I had. But before we kind of get started in the demo, I'll just kind of turn it to Jody and Guy to see if there's anything else they would add from the HQCA or from the panel reports team.
From my perspective, yeah, it's unfortunate that the timing of everything, and we really do appreciate everyone's help. This is not a permanent stop on the panel reports. This is a pause. So I hope no one feels like their time and efforts were in some way wasted because of us delaying the release.
Thanks, Jody. Guy, is there anything else you would add?
No, I don't have anything to add. Just a welcome to everybody who came to listen today. Thank you.
Perfect.
Anila?
Yeah, please, Ashi.
Ashi, I'm just wondering, will there be communications going out publicly that this is on a pause right now?
Yeah, I'll let Guy speak to that.
Okay, great.
Yes, yeah. So we will communicate to the folks who are aware that we had set the March 17th date. So we'll be reaching out to those folks. It hasn't been widely communicated that March 17th was our planned date of release.
Perfect. Thanks, guys. So yeah, Ashi will develop some messaging and make sure it goes out to the physicians and then to our stakeholders, and you should feel free to distribute as needed to your stakeholders as well.
Excellent, that's great.
Any other questions?
Oh, Sue is asking a question. She asks, will we be postponing our IF or PF network training? I think that's supposed to be IF. Is that the Thursday one?
Yeah, it's the Thursday one. I think, Sue, let me get back to you on that. I'm not sure. I think it depends on the guidance we get from our leadership team on whether it's okay to pursue or whether it will be seen as more than what people can take on. So I'll keep you posted. Thanks. Any other questions? Okay, Jody, over to you.
Okay. So yeah, I'm just going to give you very brief look at what we've done. So I assume everyone can see my screen. If not, let me know. And I want this to be as useful to you as possible. So if you have any questions, let me know. If you want to see anything in particular in the reports, by all means, let me know that as well. But I'll just start with sort of the high level overview. So this is the home screen. So when a physician first logs in, this is what they'll see. There will be a message to the physician saying who their PCN and zone is, as well as that information up in this top table. Then we've got the sections of the report as icons. One of the things we did this year that we really wanted to do was make it so that there could be a printable summary of the report, so we didn't have to produce the PDF reports as well as the digital reports. But I just wanted to very quickly show you, I'll show you this in just a sec. Navigation for this year has changed quite dramatically from last year. So let's say you wanted to go to a specific section. This allows you to actually go to whatever measure you want directly from the home page. So we've tried to limit the number of clicks to get anywhere, and I think the most to get from one place in the report to another is 3 clicks. But you can see when you hover over, you can go to these individual measures, or if you want to go to the landing page for the section, you can actually click the title at the top of this pop-up. But let's start with the printable summary. So one thing I did want to point out before that actually is you've got the option to also use this full screen mode. So we've designed it for our screens here in the HQCA office. We recognize there's resolution differences. What we recommend is using the report to get sort of a view that looks most like what you're seeing on my screen or how it was designed. You just hit that expand, enter full screen mode, and you can do that. So I'm just going to navigate to the printable summary. So this is the printable summary. And what we've gotten here is a summary of your data compared to your PCN zone, highlighting where there's significant differences with either green text or orange text. Then we've also put in a 3-year summary. We know quality improvement is about changing things over time with interventions. And so we wanted to be able to have sort of a look back at your particular panel's measures year over year, so that you could see if there's any difference, if the efforts you're putting into a quality improvement project has actually done anything. In the printable summary, we've also got pretty much all of the measures, not every single one, but the vast majority of the measures in the report in this printable summary. And in order to actually print this, all you have to do is click on this, we call it a snowman here, but the 3 stacked dots, hit print, then hit print again. And this will actually produce a PDF, which you can then print. So this takes generally about 5 to 15 seconds, depending on your internet connection, to pop up, but it should very shortly pop up. And what you'll be able to see is that we've got I think it's 16 pages, and it popped up on my other screen, so sorry about that. But basically, the vast majority of the contents of the report in the digital environment are in this this printable summary. So for it's sort of grouped by sections. So we'll have like a page like this is panel characteristics. On the next page, we'll have a description of what the measures are and sort of a brief definition of what you're looking at. So in total, this report is 16 pages and goes through all of the sections from actually, we'll start here from practice characteristics to our newly added lab utilization section, which is here. One of the things we really wanted to concentrate on this year as well was trying to speed up the system. I know there's a lot of, that was a big limitation of last year's system. So with some brilliant work by Wally, we've actually increased the speeds of things. So this is a lipid screening. If you remember last year, it took generally about 15 to 30 seconds for a filter to actually register. So let's look at how fast it is here. So it'll take a couple seconds, but it's significantly faster than what we did last year. On top of that, one of the things we tried to do was identify by PHN patients who hadn't been screened, those with low continuities, those on or those with low continuity, those with potentially avoidable ED visits, and what are the other measures? And then measures around pharmaceutical use. So what we've done is we've put in this this little information icon. If you click that, in a matter of seconds, things will pop up, and it'll actually show you the PHNs, which then can be either exported or printed off. So you see these PHNs are scrambled because it's not a CPL report, but we feel that this functionality was one of the major reasons we wanted to move to digital reporting in the first place, and just the fact that you can export it, like this as either an Excel workbook, a tab separated value, or a comma separated value spreadsheet. I think that's fantastic. You can also print with the little print icon up here, or by clicking and select print. The next thing that I want to show you, and no, that's not the right tab, is the lab utilization section. So we worked very closely with PLP to design this section. So we look at 5 different tests, from complete blood counts to urinalysis here. And we look at lab utilization in 2 ways. The first way is looking at how your patients are getting labs ordered on them. So this is both by other healthcare providers as well as yourself. And then we look very specifically at how you're ordering in as a physician in relation to what we're calling a periodic health exam. So this is a combination of procedure code 0304A with diagnostic code V20.2 or V70. And so we wanted to sort of separate that out, how your patients are using labs as a whole, and then how you're ordering in relation to a periodic health exam. One of the wonderful things about this section is we structured the data a little bit differently, and so now things are almost instantaneous once you start playing with the filters. You can see how quickly that is. There's really no delay when it comes to this, as opposed to the slight delay that we have in the other sections. One of the other things we did in here, and credit to PLP for this, was we put in some videos. So these are short little vignettes, generally under a minute long, to help answer questions. And what we felt was important was sort of that peer-to-peer learning. So here we have Dr. Chris Nogler. We've also got videos with Dr. Mike Allen, sort of explaining little tidbits, like, for example, what should I consider when ordering a lab test? And in total, I think we've got 21 separate videos. And so it really will help to sort of stimulate thought about the measures. Again, with this section, we're not saying there's, higher is better or less is worse. It's sort of for the physician to reflect on in terms of how they're ordering, rather than, you should be doing this many tests, or you should only be doing this many tests. So I just want to put that out there, because I know in this day and age, with the political climate the way it is, a lot of people jump to the conclusion that this is a judgment. But this is way more a reflective activity, as opposed to us saying you're doing it right or wrong. Maybe I'll stop there and see if there's any questions, or if there's any sections or any measures that anyone wants me to go through.
I can unmute the lines one by one if you like.
That would be great, yeah.
All are unmuted.
Awesome, awesome. So any questions, anything anyone wants to see? Apparently not.
There were 2 comments in the chat, just so you know. Sue Peter says, love the speed. Thank you, Wally. And I believe Sandy Foss agreed that it's going to make such a difference. Impressive.
Yeah, we upped the hardware, and Wally worked some magic for sure, in getting the speed to be what it is, because there is still that second or two delay, but we are going through 15 million rows of code with every time you change anything. So I think it's pretty impressive. We're able to get go through over 50 gigabytes worth of data relatively quickly. I also just want to make this plug. If you're trying to sell this to someone, and maybe it's just me who really loves this, but this system answers now over 100 trillion different questions, not all of them being clinically relevant, of course, but we've got that ability to answer that many questions. So in regards to any measure that we have, the physician can slice and dice with clinically relevant filters in order to get the answers that they want. No other questions or comments? Okay, any other changes to the report we should be aware of, like no longer including comprehensive care plans? Yeah, so we did remove comprehensive annual care plans just because, physicians not being able to bill for it anymore. The other thing we did was we looked at, last year we were looking at antipsychotics in older adults. We've actually expanded this to all sedating medications and the ability to break this up. So if we just take a second here to load this up, and I can show you what this looks like. There is still a little bit of load time when you load up new sections, but it is significantly faster. And this is just because it takes time to transfer off our servers what's being visualized, and then any changes that you make are relatively quick to the data. But as you can see, this is sedating medications in older adults. So we're looking at, as a default, patient 65 years old and older. So we look at all sedating medications. We look at antidepressants, antipsychotics, and then other sedating medications. So this would be anxiolytics, anti-epileptics, and sedatives and hypnotics. But we actually provide a list of how things are broken down. So here's the antidepressants, antipsychotics, and the other sedating medications. Any other questions? Oh, one thing I did want to let you know is for those who are delegates, you'll now be able to scroll through those physicians who you have access to. So let's say you had 50 physicians, this would be a drop-down list of the 50 different physicians, and then you could select that way. Last year, we were using a text box where you had to actually type them in. We've switched to drop-down to make it just that much more functional for delegates, because what we're starting to see is there's a lot more delegates requesting reports these days. We've actually we haven't released yet, and there's more delegate requests than we had all of last year. So we have tried to address that to make it a little bit easier. With that being said, when you switch sections of the report, it will default to the lowest value of PRAC ID. Maybe
Jody, do you want to comment on the videos that Rhonda is developing so the team knows what pieces will be available?
Sure. Yeah, so Rhonda, who's kind of our education specialist here at the HQCA, is working to develop videos in terms of how to navigate the report, things like printing, things like, ideal screen resolution and using this to enter full screen mode, and also things like the ability to, where to go, to actually reset things. So back to their default. So, one of the things that you can do, of course, in any section of the report is change your comparators. So let's say Cold Lake and North Zone. If you wanted to go back to what your default is, your own PCN, or when you requested a report, what PCN you entered, you can just hit the use my default, and you can see things change back to what they were before: Calgary Foothills, Primary Care Network, and Calgary. So we are developing those little things to help with navigation, because we recognize this, not everyone's used to this system, and we changed things dramatically since last year in terms of navigation. But we're trying to help the users of the report with getting through things and making the most of this environment. Any other questions or comments? Well, in that case, if you do you have any questions afterwards and they just pop into your head, by all means, you can email anyone on our team here at the HQCA, and we can get you the information you want. But if not,
Jody.
Yes, go ahead.
I'm just wondering, did you see, taking all the political considerations into play, did you see any increase in the number of physicians that were asking, or number of physicians that were submitting a confirmed patient list?
I couldn't comment on the confirmed patient list, being as we haven't released yet, and generally the order is of release is the proxy panel reports, the PCN, and then the CPL. So they're not really available, but we have seen a steady increase in the number of physicians. So we actually looked back and looked at all of the different report recipients in the past, and you do see a pretty steady linear growth in terms of those using the reports and requesting the reports.
That's good. And I'm just wondering, just in terms of sort of outreach, do you know if there's any areas that might be lower, like Calgary versus Edmonton, or North Zone versus South Zone, or anything like that? Just might help sort of communication strategies going forward.
Yeah. So we have that information. I couldn't tell you off the top of my head the relative numbers, but we, in some PCNs, we have almost full coverage where every single physician's requested them. In other PCNs, it's only a handful of people, and I think part of that's due to how the relationship between some PCNs and AHS and access to the data, and others who don't have such good access coming to us for the reports.
Excellent. Okay, thanks.
Jody, it's Sandy here. Just a question. So the proxy reports go out first, then the PCN, and then the confirmed panelists. Will you consider sending out those PCN reports so we can start perusing through them a little bit, even if you're not sending out the proxies to the physicians?
That is one thing to consider. I don't know that I can comment on that now. There's a leadership team meeting happening as we speak. I can see perhaps our leadership team being willing to do that. And the PCN reports are probably a week away from, well, maybe we'll say 2 weeks to be safe, from being ready. So that's something that I'll bring to leadership, and we'll see if see how they respond to that.
And it's a good question for my part, because I used to just cringe at the thought of these reports coming out and having to look at them. So this can be marked in the calendar as the day I'm actually asking for the PCN level report so I can look at it. So this is a good thing.
Awesome. I thought I saw. Yeah, no other. Are there any other questions or any other comments? Anila or Guy, is there anything either of you would like to add?
Nope, I was just chatting with Guy in the background, and he reminded me that to the physicians we communicated we will release the report sometime in March. So we'll have to see if that will still be true or not after the leadership team meeting. And to the practice facilitator, I had communicated the date March 17th, so I will go back and re-communicate with them once I have more guidance.
Perfect.
Thanks for clarifying that, Guy.
You're welcome. Yeah.
Well, if there's no other questions, I can give everyone 4 minutes of their day back.
Perfect. Thanks.
Thanks,
Jody.
everyone.
Yeah, thank you, everyone.
Thanks, Jody. Yeah.